Hey everybody, welcome back if you have come from after watching RCH1. And if you haven't watched RCH1, I would advise you to go take a peek at it because it's kind of easier when compared to RCH2. I mean, RCH2 is not hard either, just that there is a lot of topics to be covered in RCH2. The two most important thing when it comes to RCH2 to remember is one, they still haven't started caring about or giving emphasis on adolescent health, but they have started giving emphasis on rural health. We can see the involvement of Asha here, but if you've seen RCH1, we didn't see the involvement of Asha at all. So that's one difference. And the next thing is it was started in 2005, that RCH1 was started in 1997. In this video, we'll be only looking at an overview of RCH2 because there's a lot of headings and it will be unnecessary for me to tell everything because it's kind of given in a nice way in book, except for the fact that the topics are just really scattered all over, so that kind of makes us mad. That's why I've written the topics and the subtopic in a proper manner so that it'll make the job easier for you. Firstly, let's split RCH2 into two components, mother component and child component. In mother component, first we'll be looking at emergency obstetric care. If there is a complication and we have to refer, where will we refer to? To the first referral unit. So we'll be talking about first referral unit in this area. What about first referral unit? How it should be equipped? How do you remember that? First, there will be some things about mother. That what are the things that will come under mother? Delivery, okay, so proper delivery, and that also includes cesarean section. And then the next one is child samandhapatta vishayam. When management of a sick child, if this child is referred, newborn care, and then they'll talk about family planning and sexually transmitted infection care, abortion services, and diagnostic in the sense essential laboratory services, and then treatment, which just includes blood storage facilities, and at the end transport. If you've seen RCH1, we'll be talking about emergency obstetric care, essential obstetric care, and transport over there too. So it's the same thing, but extra we'll be talking about in detail about the first referral unit. Okay, so the next thing is essential obstetric care, and what comes to mind if we think about essential 24-hour services. Okay, so that, and for 24-hour services we'll be needing more manpower, so we'll be having more nurses, more actually nurse midwife, so that. And then referral services, just referral services. And then new initiative, the MBBS doctors, they are trained, they are given emergency obstetric care training, which is called EMOC, in which we get anesthetic training, and also we'll be taught how to manage certain emergency obstetric cases, and we'll also be learning obstetric management skill, etc. So that is a new initiative, EMOC. Okay, and the next one is Janani Suraksha Yojana and Janani Shishu Suraksha Karyakaram. Okay, in JSY, the mother and Asha, who will be taking responsibility of the mother, both of them will receive incentive if the mother delivers in the institution. Okay, so that is an incentive to make sure that all the mothers are delivering in the institution to prevent maternal mortality. In JSY, they'll be receiving money only after delivery. Okay, so firstly they have to go to the hospital. For that they will need money. For paying for the transport, for everything they'll be needing money. So in JSK, they'll be giving free OPD, IPD, investigation, treatment, transport, food for sick pregnant women and sick child also. Okay, so they'll include both mother and child over here, and it's all about free of cost. Okay, and then Vande Mataram scheme. In Vande Mataram scheme, MBBS doctors or obstetric practitioners or nursing homes, they can volunteer, and if they have volunteered, the government will give them iron folic acid, TT, and all those things for free, and they can distribute it to people who come to them for free. And if the pregnant woman who is coming to the Vande Mataram clinic is having any complication, they will refer. So next thing is, in here they will be talking about abortion. Okay, and in RCH1 also they'll talk about abortion. They'll tell about how in a specific day a doctor will come to a PHC, so they will take care of abortion and PHC level itself. Here they'll be giving us two guidelines, like we can use mifepristone and misoprostol, and also we can use manual vacuum aspiration. Okay, so that is the guideline given here. And then there is something called Health Nutrition Day, which takes place once monthly, where they will give awareness to the pregnant women. So, and then there is maternal death review, where if a maternal death happens, we have to exclusively review and make sure that we find the cause. Okay, and in pregnancy tracking, why is there something called pregnancy tracking? Because most of the maternal mortality happens during the antenatal period. So if they are well taken care of during the antenatal period, then most of the maternal death can be avoided. So how do you track pregnant women? One is via Asha, like they'll come and visit them periodically, for which they will receive incentive. And we can also do mother and child tracking, okay, via Aadhaar linked something. It's a web service, okay. And then in the 26th edition, there are some new things which we have to know. The first thing is Pradhan Mantri Surakshit Matriva Abhiyan. So in this, this is also nothing but just free services. Every 9th day of month, the mother will receive free antenatal checkup, investigation and drugs, okay. And then next thing is Suman Surakshit Matriva Ashwasan, okay. Here what they're saying is that the same thing, okay, free of cost, ANC. And another thing is that no pregnant woman or a sick newborn should be denied treatment over here. That's the most important thing. Objective of this Suman is to make sure that there is zero preventable maternal and newborn death and high quality of maternal care delivered with respect, okay. The respect component is so important. And Lakshya program, Lakshya program is actually incorporated at various levels like district level, CHC and first referral units, where there is labor room and maternity OTs, okay. So this is concentrating on labor room and maternity OTs. Here there should be respectful care and quality of care should be improved, and for that they'll be producing equipment, manpower, etc. All right. And they'll also be giving training to the manpower. That's it. So next thing is Anemia Mukt Bharat, anemia free India, okay. In this, objective is that we have to give focus to the child for the first 1,000 days, and this part is called Poshan Abhiyan. First 1,000 days means we'll take care of them until 3 years. Make sure that they don't get malnutrition, and we'll take care of the mother, we'll take care of the child. And then from 3 to 6 years, they will be taken care at the Anganwadi center. So that's it about the mother component, okay. So next we'll be moving on to the child component. In this, the first one we'll be looking at is Nutritional Rehabilitation Center. So obviously in this center, they'll be taking care of children who have malnutrition. That too severe acute malnutrition, SAM, okay. What they'll do is, they'll treat the child having SAM in 3 phases: stabilization phase, transition phase and then rehabilitation phase. In stabilization phase, they'll make sure that the child regains his appetite, and they'll make sure that the child is relieved of a major medical complication if it's suffering from any. So in that, they'll be giving up a diet called starter diet. And then they'll move on to transition phase. In that, they'll be giving something called catch-up diet. Okay, then there are criteria onto how and when they will be changing the phases. Please do look over that. And the last thing is rehabilitation phase, where the child has, almost recovered from everything, okay. And then we also have to supplement nutrients, micronutrients, which includes vitamins and certain elements, okay. So what are the vitamins? Multivitamin supplement, which includes vitamin A prophylaxis. And for vitamin A prophylaxis, please do make sure to look at the doses, which is also mentioned in RCH I, and you can also look at it in the book. So, and then other vitamins, all those will be given via multivitamin tablet. And then we'll be giving folic acid and iron, both of them always together, right? And then zinc and copper. And after being discharged from NRC, the children who are discharged from the NRC, they will be given special care by Ashas and Anganwadi workers, okay. They'll be tracking them, they'll make sure that the children are fine. And then we'll move on to IMNCI, which is Integrated Management of Newborn and Childhood Illness. And I've already talked about this in acute respiratory infection video. It is a guideline given to manage the illnesses which majorly occur during the newborn and child period. And they'll divide it into 2 categories, age category. One is less than 2 months and the other one is 2 months to 5 years. And most of the diseases that occur during this time include diarrhea, pneumonia, etc. And they will go and assess the children, and then they will classify the children into 3 criteria, okay. The criteria is pink, yellow and green. That's it. AMNCA is a separate question, okay. So next thing is facility-based newborn care, which is so important. And in this, we'll be seeing 3 components. We'll go from here, okay. So because lower to higher level. This is newborn care corner, okay. And this will be present at all facility which has delivery facility, okay. And then the next one is newborn stabilization unit, which will be at the CHC level. And then the one which is present at district level is special newborn care unit. In NBSU, they'll be able to manage certain conditions. Like NBSU is divided into conditions that can be managed at NBSU, and after stabilization, they can keep in NBSU itself. that. And then the other one is they can manage in NBSU at first, but then they have to refer to SNCU. Okay, so that is one criteria. And at SNCU, there'll be certain criteria as to when you have to admit to SNCU, and then after a certain time, you have to step down, and then you can discharge. Okay, so there are criteria for that. So that's about facility-based newborn care. And then we move on to home-based newborn care. This is where the Asha is ardently involved. Asha will go for a periodic visit according to whether they have delivered in institution or home or cesarean. If institution delivery, they'll go visit them for 6 days, and if it's a cesarean section, for 5 days, and if it's home based delivery, then for 7 days. Okay, and they'll be receiving incentives based on that. They'll be having certain responsibilities, like for example, they'll keep checking the weight, they'll take care of whether they're eating properly, and if they're underweight or if they get any complication during that time, they'll refer. So all those kind of responsibilities will be there. And the next one is Navjat Sishu Suraksha Karyakaram. Navjat means neonatal, so from 1 to 28 days, and they'll make sure in this program that we'll be able to prevent neonatal death. Okay, so for that, they'll be training manpower. That's it. Alright, so that was all about RCH II. Hope it was useful. Please do check out RMNCH plus A video also. Bye-bye.